Now we're going to talk about medical terminology and why in heaven's name, if you're learning about healthcare informatics and statistics and data, why would you need to know and understand medical terminology? Essentially, medical terminology is the language of healthcare, and the data must be collected from documents in which things are explained using medical terminology and the details and subtleties of this language. It is a foreign language for all of us because nobody was born having a first language of medical terminology. And in addition, medical terminology is actually a compilation of Latin and Greek with a little bit of Spanish, a little bit of English, and a little bit of French thrown in. So it is important that you understand the underlying language from where the data comes from, in addition to your ability to properly identify the data elements, understand the details in the data dictionary, and all in all, be able to control and keep safe these terms. And here's an extra bonus for you. Medical terminology is also the language of our health, and every one of us at some point becomes a patient or the loved one of a patient. And understanding this language will not only help your career, it's going to help you in your personal life. So let's get started. Medical terms are essentially made up of three parts: a prefix, which is the beginning part of a word, the root, and the suffix, which is the ending part of the word. We also tend, as an industry, to use a lot of abbreviations and acronyms. And that's because when you take Latin, Greek, French, Spanish, English terms, smush them all together, and have all these pieces parts of prefixes, roots, and suffixes, these words get very, 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 very long. And so we end up using abbreviations and acronyms to communicate with each other. It's very important that you understand what those around you are saying. So, the first word or the first part of the word is called a prefix. And that is that very first part of a word, the beginning of the word, that gives an adjective or further usually describes what's happening with the root of the word. So, a great example that you're probably familiar with is hypertension. Now, hyper is the prefix in that term, meaning above or excessive. Maybe you've heard this used in relation to sometimes a small child or a puppy, and you say, oh my gosh, that person is hyper or that dog is hyper. That means excess energy. So that can help you remember what that means. But there are lots more. So some examples, additional examples of prefixes that you are likely to see: epi, such as in the word epidermis, and that means that something is on the skin. The epidermis is actually the name for the top, outermost layer of your skin. Intra means within, such as intraocular means within, ocular means eye, within the eye. Peri means surrounding, and that's very similar to English. So pericardium means around the heart. And syn means together, such as synchondrosis, which means two bones are joined together with cartilage. So you see how when you learn about prefixes and roots and suffixes and get familiar with their meanings, you can look at a very long medical term and figure out what it means. Now, the root is the center of the word most often, and this often identifies the anatomical site affected by whatever is going on. Now, remember that in medical terminology, we are referring to something that might be wrong with the patient, such as a diagnosis, or we might be discussing something that was done to the patient, a procedure. Okay, so that's why you might have the same root, and depending upon whether we're talking about what's going on with that root, that anatomical site, or what was done to that anatomical site. And that's going to be told to us in the suffix, but we'll get to that in a minute. Let's look at this example, gastrology. Now, in this particular case, gaster is the root, even though it's at the front of the word, and that refers to the stomach. Okay, so this tells you gaster, and then you're going to learn the suffix ology, which means to study. You now know that gastrology is the study of the stomach. Get it? Let's look at some more common examples. Dermis means skin. Remember when we were looking at prefixes, we talked about epi. Now, if you do epi, which means on, as you learned, and then you take dermis, the root, which means skin, that gives you the whole meaning of the word, which means on the skin. Ocular, remember you learned this with intra in a prefix. Now we take this prefix intra, which means within, put it together with the root word ocula, which means eye, and now you know it means within the eye. Cardia means heart. So when we take peri, which you learned as a prefix meaning around, put that together with the root cardi, and you have around the heart. And chondra, you learned about sin meaning together. Now we have the root word chondra, which means the cartilage is together, and then osis, you will find out later when we talk about suffixes. You see how this enables you to interpret a lot of medical terms just by taking it apart. So now we've referred to these suffixes a couple of times, so let's get to it. This is at the end of the word, and it will identify, as I just mentioned, it may identify a condition such as an inflammation or a pain. Okay, or it may refer to a situation or a procedure. Okay, and in this case, we have an example, terminology. So term means words, and ology means the study of. So terminology means the study of words. Let's look at some more examples. Itis, you might be familiar with this. Itis means inflammation or infection. So that's going to point to a diagnosis such as dermatitis. You learn derma means skin as the root. So we take that root word and we put it together with the suffix of itis, and you get this patient has a skin inflammation or a skin infection. You might see the suffix lar, L-A-R at the end, and that just basically means pertaining to. So, for example, the physician may say this patient has an intraocular abscess. Okay, that would tell you that the abscess is related to the inside of the eye. This you may see often, which is dynia. And dynia is actually the suffix that refers to pain. So if a patient is diagnosed or said to have pericardidynia, that's telling you that this patient is having pain around the heart, also known as angina. Oh, we'll get to that later. Okay, and osis, you remember, we talked about this before. Synchondrosis means there is an abnormal connection between the two bones that are being held together with cartilage. Oh, something is going on. So as you can see, This is not absolute for all terms because there are terms like abscess that you cannot take apart and that you do need to learn or look it up in a medical dictionary. Do not let a word get by you that you don't understand. And also, because you can use a medical dictionary, that will help you get very familiar with the terms that you're going to work with on a regular basis. And then you can understand what's going on around you. And when those clinicians are speaking, you can at least understand what's going on in the conversation when you are asked to do your part of whatever the team needs from you. So, regardless of what your future role is going to be, you need to understand the language of your work environment. Now, as I mentioned before, we use a lot of abbreviations. There are a lot of abbreviations, and I'm just going to talk and let you take a look at the screen. And you can also print this out for reference, but even better, make sure you get a medical dictionary that has an abbreviation section in it. Most of them do. It's very important that you use your references so that, again, you understand what individuals on your team and in those meetings and with whom you are working, you have to understand what they're talking about. If you don't understand the language, it will affect your ability to do an excellent job. Imagine if you did not speak a word of Portuguese. Personally, I do not speak Portuguese. So if I were to go and move to Brazil and have to work or try to work in a hospital in Brazil, even though I understand medical terminology, I don't understand Portuguese. How can I possibly do a good job? How can I understand a report that's given to me or even my employee evaluation? How can I possibly do a good and productive job if I don't understand what those around me are saying? So, this is part of your obligation. As professionals in healthcare or future professionals in healthcare, and certainly you're a future patient in healthcare, you need to understand the language. Do you have any questions? Everybody usually does. Please ask them. We love questions.